Hello, friends. I am Dr. Kushal Nag. I am a foot and ankle surgeon and a diabetic foot specialist. Today, we're going to talk about the diabetic foot and its complications. So, what is a diabetic foot? A diabetic foot is a condition where the nerves at the end of your feet slowly start dying out in people with long standing diabetes. So, as a result of which, the sensations in the undersurface of your feet start getting less and less. As a result of which, due to repetitive microtrauma, you end up getting corns, calluses, and even ulcers on the weight bearing surfaces of your foot. The statistics are staggering. Out of 1,000 diabetics, almost 100 will develop an ulcer in their lifetime, and 4 will get an amputation every year. There are almost 6 crore diabetics in India today, out of which almost 1 crore will have an ulcer at any point in their life. And eventually, every year, 100,000 or 1 lakh foot amputations are carried out by surgeons in these cases. So, how can we prevent these complications from ending up in such a bad situation? Prevention is the only key, and a major part of prevention is awareness. Are you aware that you have this problem? So, how can you be aware? There are very simple tips that you can follow in order to safeguard your feet. Number one, wash and clean your feet regularly. The simple act of washing and cleaning your feet will force you to look at your feet to figure out if there are any problems that you have which needs your doctor to look at. You must examine your feet every day, or if you cannot do that, ask a family member to examine your feet. Look for any cuts, calluses, corns, abrasions, color changes, anything which is out of the ordinary. These are early warning signs which tells you that something is wrong with your foot. And if early signs can be picked up, then we can prevent further complications from happening. Never walk barefoot. In India, culturally, we always keep walking barefoot, even at home. So don't do that. Outside, please wear shoes. Even at home, please wear a diabetic chappal or even a normal chappal so that your foot is not exposed to undue pressure changes. Wear diabetic footwear. I always tell this to my patients. A diabetic footwear is a must for people who have peripheral neuropathy, in fact, for all diabetics. So, what is a diabetic footwear? A diabetic footwear is something which has medicated uppers. By medicated uppers, I mean surfaces which do not cause any friction, which are smooth, and a custom molded insole which causes equalization of pressures on the undersurface so that no point of your feet is exposed to higher pressures. And finally, get a foot exam done from a competent professional annually. If you have a foot problem and neuropathy, you can get a foot examination semi-annually. But please reach out to your doctor if you have a foot problem. That would be all for today. Thank you, friends, for your time and patience.